ADHD by Mahas. This presentation is set up to play sound and advance slides automatically. So just click the play button on your screen. It should look like the one circled in red below. Sit back and enjoy, and hopefully you don't fall asleep. By the way, I use different layouts throughout the presentation specifically for you ADHDers who get bored easily. Have you seen a student who can't sit still in their seat even if you used Gorilla Glue on their bottoms? Or the one when the teacher asks if they can name the capital of Florida and she raises her hand and says, Miss Jones, I really like Cheerios for breakfast. Then there's the student who stares out the window constantly when everybody else in the class is busy writing in their daily journals. And you can't forget the students who find entertainment in anything except what is being taught. What are all these characteristics of? Well, you probably guessed it from the title page, but yes, you're right. ADHD. What is the purpose of this presentation? You might be asking, why should I sit through the next 18 minutes and 32 seconds of this presentation? Because teachers play a major role in identification, and learning about ADHD will help you recognize symptoms and understand procedures for referral and evaluation. Also, I truly believe that a lack of teacher training in intervention strategies is potentially tragic for students who may fail because their teachers didn't know how to help them learn. What do you know about ADHD? Couple questions to think about during this PowerPoint. How many types of ADHD are there? Is ADHD a learning disability? Does ADHD automatically qualify a child for additional services? Is ADHD a newer disability? Can a student with ADHD show similar behaviors as an English language learner? Let's start with ADHD. What is it? Attention Deficit Hyperactivity Disorder, ADHD. It's a neurological condition defined by hyperactive impulsive behaviors and/or inattentiveness that interferes with everyday life. ADHD is divided into 3 subdivisions as follows. You have your predominantly hyperactive impulsive type, the predominantly inattentive type, or a combination of both hyperactive and inattentive. Characteristics of each type of ADHD. The predominantly inattentive type is easily distracted by any external sight or sound. If a student behind them is tapping their pencil or somebody's walking by, it'll take their focus off of the task at hand. They don't pay attention to detail, causing them to make careless mistakes. They might have a problem sustaining mental effort. They have difficulty listening when being spoken directly to, which then leads to them rarely following instructions or finishing tasks. They have difficulty keeping track of necessary supplies, pens, papers, homework. They'll struggle paying attention not only in academic settings, but also with social activities. They tend to be forgetful, even with daily tasks that they should already know. Most definitely they can be disorganized. This is the student you look in their desk and you think, oh my, how do you find anything in there? Next, we have the predominantly hyperactive impulsive type. That's the restless one. They have trouble staying seated. They're rocking back and forth on their seat, tilting it or getting up, finding reasons to throw little pieces of paper away. They want to run or climb when it's not appropriate. They often blurt out answers before they even hear the whole question. They can have difficulty waiting in line or waiting for their turn. They often interrupt other people, and they can talk excessively. They most certainly can have difficulty with quiet activities. And they're constantly resisting that urge to be on the go, making their bodies kind of fidgety. And then, of course, we have the combined type, which is the most common. Children who display characteristics of both categories could be classified in the combined type. Now, might be thinking, wait, I have some of those. Do I have ADHD? Well, everyone shows some of these behaviors at times, but there's specific guidelines for a child to be diagnosed with ADHD. First, they must exhibit 6 or more of the following characteristics in either type in order to be classified. In addition to the student showing 6 or more characteristics in a category from the previous slide, for a student to be diagnosed with ADHD, their symptoms must interfere with at least 2 daily functions: home, school, social settings. So if they're only having the problem at school, but their home and social life, everything is just fine, they might not receive the diagnosis. Also, their symptoms have had to started before the age of 12. Their behavior must have continued for at least 6 months. They want to make sure that it's not due to something else. Say the parents are going through a divorce and the student is acting out a little bit. They want to make sure that it's attributed to ADHD. Lastly, it can't be attributed to another disability. So say the child is hard of hearing, causing characteristics or behaviors that look similar to ADHD. They're going to eliminate and make sure that it's not something else before giving that diagnosis. When was ADHD first recognized and labeled? Is ADHD a newer disability? It doesn't seem like it came into the spotlight until 20 or 30 years ago. But, in fact, it goes back to 1798. There was a Scottish physician who wrote a book, An Inquiry into the Nature and Origin of Mental Derangement. And a few of his quotes from his book was, "The child has difficulty sustaining attention in tasks or play activities," and "the child is often easily distracted by external stimuli." Sound familiar? A little bit. Then in 1845, a German physician wrote 2 books that describe ADHD in great detail. One was Fidgety Phil, and the next was Johnny Up in the Air. He didn't label ADHD as such, but he's considered the first medical official to describe it. In his book, Fidgety Phil, Phil displayed the classical hyperactive presentation, where there's a family conflict at dinner and Phil can't sit still in his seat, rocking back and forth, finally tipping over, causing all of the contents on the table to fall over. His book, Johnny Look in the Air, was about a little boy named Johnny who was always looking off at something else, wandering, not paying attention, causing him to fall in a river. Both types of classic ADHD were displayed. And remember, this is 173 years ago. So if it's been around that long, what was it named before it became ADHD? In 1902, a pediatrician described a group of children who were disobedient, emotional, and uninhibited, and victims of poor parenting. He classified it as morbid defect of moral control. Then, in the 1920s, there was an encephalitis outbreak, and survivors of it showed symptoms of ADHD. So they believed maybe it wasn't due to poor upbringing. Maybe there was something else, calling it post-encephalitis behavior disorder. In the 1930s, They thought it might be caused due to minimal brain damage. And then in the 1960s, they decided to classify it as minimal brain dysfunction and hyperkinetic reaction to childhood, whatever that means. In 1979, they considered it the hyperactive child syndrome. In the 80s, it finally got close to its name, attention deficit disorder, ADD, but it was classified as having been with or without hyperactivity. It wasn't until 1987 that it received its name, its current name, ADHD. And then in 1999, actually March 12th of 99, IDEA added ADHD within the definition of OHI. IDEA and ADHD. Individuals with Disability Education Act, IDEA, does not have ADHD as a listed disability. Instead, it's listed within a subcategory of other health impairments, OHI. So OHI is defined as those having limited strength, vitality, or alertness, including a heightened alertness to environmental stimuli that results in limited alertness with respect to the educational environment that is either due to a chronic or acute health problem, such as ADHD, diabetes, epilepsy, a heart condition, hemophilia, lead poisoning, leukemia, nephritis, rheumatic fever, sickle cell anemia, and acquired brain injury. So none of those are specific learning disabilities, but they can all, like number 2, affect the child's educational performance, which would then qualify them under OHI as having one of those issues, which ADHD is listed. Children may be eligible for services through the IDEA under one of 3 categories. 1, other health impaired. Like we said before, the child might receive services solely on the basis of their ADHD, but only if it's severe enough to cause an educational impairment. The second type could be a specific learning disability. Research shows that 30 to 50% of children with ADHD also have some specific learning disability that might qualify them. The third qualification might be a seriously emotionally disturbed. Some children with ADHD have coexisting emotional problems that would qualify them, but only if it impairs their education. So how does the evaluation process for the student with ADHD go? So first we have the observation. Either the teacher or the parent observes some of the characteristics for one of the types of ADHD. So the screening process is then put into place. And they'll do assessments. They'll measure the classroom work, they'll do group intelligence tests, group achievement tests, medical screening, and also vision and hearing to make sure that one of those isn't the reason for these characteristics. Next, they'll have the pre-referral stage, and the teacher implements suggestions from the school-based team. Once that process is done, they have the referral stage. The student is referred to a multidisciplinary team. Then the non-discriminatory evaluation procedure and standards. They do assessment measures. They'll do psychological evaluations, the individual achievement test, behavior rating scales, teacher observations, curriculum-based assessments, and direct observation. Once those steps are done, they'll make a determination, and the IEP team will develop an appropriate educational plan for the student. Strategies we can use in our classroom. I found this quote: "If they can't learn the way we teach the way they learn." So how can we include students with ADHD in our classroom? One way is to assign work according to the student's skill level. Often, students with ADHD will avoid classwork that is either too difficult or that is too long. Establish classroom rules and routines. This will help the student with ADHD stay on task. It can be something as simple as they must check in with the classroom aide at the end of the day to make sure they understand the homework assignment and what's required of them. Encourage hands-on learning. Create learning opportunities where the children experience things firsthand, like have them write and act out a play or record an assignment on videotape. Provide visual reminders. Students with ADHD respond well to visual cues and examples. For instance, if you're just demonstrating a skill like writing an essay and you write it on the overhead projector, when the students get to their independent work, leave some of the key topics visible on the board for the student to look back at as they're doing their work. Increase active participation. You can ask the students to participate so we know that their brain is corresponding with the rest of their body. For instance, if you're asking questions, yes or no questions, have the students either give thumbs up if the answer is yes, thumbs down if the answer is no, or a flat palm if they don't know the answer. Also, offer choices. Students with ADHD like to think they have the choice. So if you're working on an activity of practicing spelling words, give them a list of options. Either they can practice by writing the word on flashcards, they can use them in a sentence, they can do air writing words. Give them options so they feel like they're an active participant in their learning. Interventions and/or modifications. Possible IEP interventions or modifications we can use are designate a low distraction area for the student to either take tests or do their work. Allow the student to sit near the instructor to minimize the amount of distractions the student is exposed to. If possible, provide the opportunity for movement. The picture to the right, it shows they have the seated bicycles, which would be nice. I know not always practical, but allows some sort of movement. Provide the students with a weekly schedule and possibly help the student create and use an organizational system. Organization is a huge part of their learning and they need to have a system that's easy to follow. These are just a few. Attached to this PowerPoint, you'll find the Miller's 9, which I listed several more interventions or modifications that can be made. ADHD versus English language learners. When I was looking through characteristics of both types, I found that several characteristics can be explained with either type of student. For instance, student becomes distracted easily. Well, it's a hallmark sign of a student with ADHD, and it can be explained with an ELL student as they haven't received enough visual material in English. I know if I were sitting in a class and they were all talking Japanese, I'd probably tune it out and become easily distracted, not understanding what was going on. Does not seem to follow directions. For the ADHD, it could be explained as distractibility. For an ELL student, they might not understand the directions. Seems to get easily frustrated. For the ADHD student, it could be due to poor affective and/or emotional control. For the ELL student, it could be due to they're worried about making mistakes in English and they want to get it right, so they're getting frustrated with themselves. Student omits or adds words to a sentence or forgets names of things. For the student with ADHD, thoughts in their head often move faster than their mouth or their words can express. For an ELL student, they might not have that English vocabulary yet, or the grammar structure might be different in their home language, adding them to causing them to either add or omit words. Beneficial assistive technology. There are so many things that can benefit and help a student with ADHD in the classroom, and this is just a really small example of things that I found. A mini tape recorder allows them to dictate their assignments, or even their phone or an iPad to take photos of the assignment. They can use a computer for written work with speech recognition programs, spell check and grammar check software, or maybe even audiobooks. There's also electronic math worksheet software or talking calculators. These are just a few of several ideas that can assist a student with ADHD in the classroom. Federal statutes. Children diagnosed as having ADHD are covered under 3 federal statutes. One, IDEA, the Individuals with Disability Act, Part B. Another one is Section 504 of the Rehabilitation Act of 1973, and also the Americans with Disability Act of 1990. Now again, diagnosis alone does not qualify the student for education. The ADHD must impair the child's ability to benefit from their education. Okay, so what did you learn about ADHD? Do you remember how many types of ADHD there are? You're right. There are 3 types: predominantly inattentive, predominantly hyperactive impulsive, and the combination of both. Is ADHD a learning disability? No, ADHD is not a learning disability. Does ADHD automatically qualify a child for additional services? Nope, ADHD alone does not qualify the student unless the case is so severe that it affects the student's educational performance. How about, is ADHD a newer disability? Nope, disabilities that closely resemble ADHD were discovered almost 200 years ago. Lastly, can a student with ADHD show similar behaviors as an English language learner? Yes, characteristics of ADHD may resemble characteristics of an English language learner. If you made it this far through the PowerPoint, I want to thank you for hanging in there. I wanted to leave you with a few inspirational quotes. If you'd like, you can stop the video now and read these at your leisure. Also, the next slide provides several organizations dedicated to ADHD if you'd like to learn more information. Again, I really appreciate it. I hope you learned something.